Cannability Consulting is changing the way healthcare views cannabis. As a subsidiary of Westminster Canterbury and Chesapeake Bay, Cannability provides education and consultation, guiding individuals and healthcare providers through the complexities of hemp and medical cannabis.
We help individuals and healthcare providers navigate through the weeds of hemp and medical cannabis. So that means a little bit of everything between helping an individual one-on-one learn a little bit more about how to safely use the cannabis plant in a therapeutic way to meet their health needs and their health goals.
Cannability was born from Dr. Alex Hill's passion for healthcare and cannabis, with full support from Westminster Canterbury's leadership.
As Alex was talking about getting her graduate degree, and I said, "What are you passionate about?" She says, "Cannabis." And I said, "Well, then study everything you can about cannabis. And when you're done your program, then we're going to start up a business."
And they did. Now, Cannability's evidence-based approach ensures clients can safely navigate the often confusing cannabis market.
The market is not yet centrally regulated, so it's really a buyer beware consumer literacy opportunity to make sure that you are getting what you think it is that you're purchasing and that it is helping you in an effective way.
We started out with doing consultations to individuals that had ailments and issues that really weren't being addressed well with medication, or they really were tired of taking a lot of medication for pain, for arthritis, sleep. So we started out with our own residents, and then it expanded to their family members and healthcare especially. The residents in our healthcare setting have really benefited from the CBD and THC and cannabis, especially those that have dementia and are agitated, can't sleep, not engaging well, may be aggressive, may have sundown syndrome. So those individuals have benefited quite a bit. So we started there, and then we've expanded out to healthcare locations like our own. We've gone to life plan communities, we've developed policies for them, we've done conferences where we have educated their staff, we've gone to their locations and talked to their physicians and talked to their nursing staff so they feel comfortable suggesting the product.
We actually can work and partner with your primary care physician, because oftentimes they're calling us and saying, "Hey, I have a patient who's asking me these questions and I don't quite know the answer. Can I send them to you?" And so in return, you could say, "Hey, I don't really know how to talk to my primary care about this. I'm not sure that he understands. What information can I take back to him, or what can be shared with him, or what can you do to help bridge that gap?" And we help do that too.
Cannability's mission is clear: to change perceptions and highlight the therapeutic benefits of cannabis.
And I think it's important for people to know that we've seen folks have really life-changing results and improvement to their quality of life in ways that they had not previously seen possible. It doesn't work all the time for everybody in every circumstance, but it's something where when we take the stigma and the barriers and the bias away from it and really see it for medicine and treat it as such, we can really see a change.
We now have our nurse practitioners and our psychiatric nurse practitioner that comes to us first before prescribing any psychoactive drug. Say, "Let's try this first," instead of putting an older individual who has lots of issues on a heavy-duty antipsychotic drug. We do a lot of business with hospice organizations, and instead of giving a comfort pack to the hospice individual, they're now supplying the cannabis product, which people are loving because they're still very alert and oriented, but it helps to address their pain and their anxiety.
Cannability is expanding its impact, educating healthcare professionals, and offering safe, researched solutions for patients across Virginia and around the country.
What I want them to know is that this is an alternative to what is being done now with medications that have a lot of bad effects on individuals. This is an alternative that it's safe, and that we will stand beside them and help them navigate through the weeds, as we say, on what it is that they need and how can they improve their lives through cannabis.
Cannability Consulting, helping people navigate cannabis with clarity, comfort, and peace of mind.